I used to work in the public sector and have seen a few really nasty incidences of like really young kids being given like Coca-Cola, like to sip on when they're infants, you know, just to ease them to bed. And you know, I've had to take out every single one of their teeth when they're little babies and things. So, well, not little babies, but young. And yeah, it's really sad to see. So, you know, juices, soft drinks, energy drinks, most alcoholic beverages, even sparkling mineral water, carbonated beverages, kombucha, you know, these sorts of things can be even the ones considered healthy, can be quite nasty for your teeth because your enamel will start to erode away at a pH of 5.5. And so water's neutral at 7. And, you know, wine's 4 on the pH scale, kombucha's 3 on the pH scale, juices are like 3 to 4 on the pH scale, even carbonated water is, you know, quite low at around 4 as well. So there's things that are best avoided. Water's obviously best, and still water, I mean. And yeah, all these juices and all these other processed sort of drinks are problematic.
Welcome to Wellness Spring, our one-stop shop for education, inspiration, motivation, and optimal wellness. Learn from top experts and exceptional people. Welcome, dear friends, to Wellness Spring. Today, I'm blessed to be interviewing an extraordinary soul and super high achiever. His name is Dr. Ehrlich. He is a holistic dentist, health coach, personal trainer, and he's also got his own podcast called Mouthing Off. I actually met Lewis a few months ago in his dental practice because traveling in my camper van, it's not easy to see a regular dentist, and all of them are booked for 3 to 6 months in advance. So I was very blessed that someone put me in touch with him and they managed to squeeze me in. And I was blown away with his wonderful knowledge, experience, and professionalism. It was just so lovely. He met me in the waiting room, took me to the room, and then brought me back out. And it was just that personal touch, which was really lovely. And we'll talk about my session or general session during the course, I'm sure. So welcome, Lewis, to Wellness Spring.
Thanks so much for having me on. Pleasure to be here.
Pleasure. Before we delve into your dental practice and your amazing diverse career, could you please tell the listeners about your background, your family, education, where you grew up and so forth?
Yeah, I was born and raised in Sydney, and my dad and my uncle are both dentists, and they started the Sydney Holistic Dental Centre in the early 1980s. So that sort of mentality or a way of practicing dentistry was quite unique at the time. So I've been exposed to it my whole life, and I suppose there was always a chance, given my interest in health and wellness through my teenage years and into early adulthood, that I was going to follow in those footsteps. So yeah, before I was a dentist, I played professional soccer overseas and did my first degree over in Boston on a soccer scholarship, and then played professional soccer in Iceland. And yeah, I've always been interested in human performance and health and trying to get the most out of people's health. And so I just thought it was a good fit having my dad and my uncle set the example as I was growing up. And yeah, it's great to follow in their footsteps.
Yeah, that's good to hear that, because a lot of children, you get pressured to following your father's footsteps, and most people don't want to do that. And I know that you mentioned, but when we chatted, you said you got that award, a scholarship to go to Boston and study soccer and play soccer. And did you ever think that soccer was going to be your number one?
Yeah, I mean, there was a period of time there where I lived and breathed soccer. I didn't want to do anything else. I was out every day practicing, training in the gym, very, very one track minded. So yeah, I always wanted to play full time soccer for as long as I possibly could. But what you find is that the reality of the situation is it's quite difficult to play at a really, really high level because there's so many people around the world that are attempting to do the same. And so when I was about 24, having played, or 23, having played a fair bit of full-time soccer professionally, etc., I just thought when I got into dental school, I put in an application and got in. I just thought long term it would be a better option, and it's probably proven to be true. And I think, you know, being able to help people on a day-to-day basis with their health has been very rewarding, and yeah, it gives you enormous satisfaction. But interestingly, I think that having my soccer background has helped me a lot. There's some similarities between having a specific skill set in the realm of professional sport, and then having a specific skill set in the realm of, you know, dentistry, oral surgery, and some of the other stuff that I do. So yeah, I was able to take the attitude that helped me succeed on the sporting field, and then I've applied it to my study and my career. So even though they seem like they're worlds apart, and they feel like they're worlds apart at times when I think about it, um, it's actually held me in good stead. So yeah, there's some correlation.
That's great. And I'm glad you mentioned that, because I was very friendly when I was living in Monaco with a psychologist who was working with the Monaco football team. And when the World Cup was up and some of the players that were from the Monaco team were doing exceptionally well, and he said exactly what you said. He said the best role models to have on your team, especially in a team business situation, any corporate, is to have a soccer player, because they can teach you discipline, they can teach you focus, they can teach you about teamwork and so much more, and getting things on time and seeing the oneness and the wholeness. And I guess, you know, because yours is the family business, I guess you have to be aware of the people who are not part of your biological family, and to draw them in and use their skills effectively, so and make them feel that they are part of your family. And before we go into dentistry a bit more, can you tell us what it was like in Iceland, and why did you choose playing in Iceland?
Yeah, it was amazing. It's a beautiful country, small country, only about 330,000 people. And I hadn't met or known anybody in Iceland before about 2007. And then when I went over on a soccer scholarship to Boston, actually there was an Icelandic guy who also got a scholarship to our university, and we became really, really close friends, and we still are to this day. And so, yeah, we just really hit it off, and yeah, just ended up through the connection with him. Yeah, ending up going over and trialing for some soccer teams over there, and getting a contract and staying there for about a year or a year and a half. So, yeah, it was an interesting experience, a beautiful country, great people, quite similar sort of humour to Australians. So it was actually quite easy, despite the weather, to settle in and feel at home. But yeah, the January months and February and the middle of winter can be pretty tough, considering I'm a beach guy from Sydney, so used to the sunshine, but it was great, and I don't regret it for a second. I look back on it with very, very fond memories.
Wonderful. And yeah, like you say, it's extremes of weather, but it's great knowing the culture as well, learning a different one. And I guess as well, because your dad and uncle are very well known, it would have been hard to try and step in their shoes. I actually met your dad many, many years ago when I was teaching sports massage to the rugby union students and teaching about the importance of stretching to various corporations. So I gave a talk to dentists, periodontists, and all oral health people. And yeah, I know they've got brilliant reputations. And yeah, one of them gave a talk to the Holistic Business Network as well, and talking about the importance, I think it was your dad, talking about the importance of oral health as a whole health, and he was way above his time. So I guess you've got big shoes to fit, but I know that you graduated from the James Cook University, the JCU, with an academic medal. So it's like, woohoo, can you tell us about this medal?
Yeah, I mean, I think the person that gave that talk would have been my uncle, actually. My dad's not much of a public speaker, but he's very, very much into the same mentality, but he likes to keep to himself a bit more on that front. So it would have been my uncle. But yeah, the academic medal, yeah, it's just rewarded to people that obviously get high grades. But yeah, I wasn't definitely expecting that to occur, but I think part of the reason why I was able to attain that was, like I was saying, with my discipline around my soccer and sport, I just applied that same mentality, that hard work, that repetition, that the dedication and just time management really helped me to get to that level, which was a great honor on the day. I didn't even know that I was getting it, but yeah, it was very, very nice. And yeah, I just also think that part of the reason why I might have got it was that I actually studied away from home, and I really wanted to get home and start working in my dad and uncle's clinic. And so there was also a fear of failure that probably drove a little bit of that success as well. So I just didn't want to fail. I didn't want to stay out there longer than I needed to, and just wanted to get on with things. But equally, I'd already done a degree, and I was a mature age student in a sense. Like, I started at 23, which is not that mature, but compared to my colleagues, a lot of them were sort of 18 when they started. And so you get a bit of life experience beforehand and know kind of how to strategize your study. So I think there were a few factors at play, but I was happy, and I'm obviously proud of the achievement.
Wonderful. And I know you've gone on to do extra studies in oral health. Would you like to let us know what you specialize in?
Yeah, so within dentistry, you can do these sort of subspecialties. I suppose the best way to describe it. And so a few years ago, I ended up enrolling, or being accepted into a surgery degree in dental implant surgery, in sinus lifting, bone grafting, more specific kind of invasive work. And so, yeah, I did that at the University of Sydney and graduated a couple of years ago. So yeah, that was my third degree. And then, yeah, I'm now studying my fourth one over at Oxford in the UK in evidence-based medicine and healthcare. So yeah, I thought at the end of that surgery degree, I thought, yeah, I'm done. I'm done with my study. I can't do any more. But I think 3 or 4 weeks later, I applied to Oxford, and I'm in for a degree again. Well, fortunately, but unfortunately.
Oh, well, I think that's wonderful news. I know you're probably addicted to the study, which often happens. And I know through I started my career as a registered nurse, and through sports massage, you had to do a 100 continuing credit units every year to keep your license open. Is that the same with dentistry?
Yeah, you have to have continuing education points, a certain amount every 3-year cycle.
Yeah.
But yeah, I always laugh with the guys at work because I always clear that by a mile, just because I'm so curious about learning. So yeah, we've got to hit targets every 3 years. Yeah.
Yeah, I think that's wonderful because I've got a curious mind and got a long list of diplomas and degrees as well. But I'm super keen for you to share more about your evidence-based um, medicine course that you're doing now, because you did hint to me when we were having a chat that there's neuroscientists and all sorts of amazing people on this course. So can you tell us what this is about?
Yeah, so it's a degree that basically allows you to understand research deeply, and yeah, you go into what's good evidence, what's not so good evidence, why, statistics, statistical analysis in research papers, um, qualitative and quantitative research, just a whole. I suppose it's a deep dive into how to conduct proper research and how to determine what's a good research paper and what's not a good research paper. And it's designed for health professionals so that they don't actually have to leave work. And so we go over for intensives and do some intensive study, and then we do the rest at home. And so, yeah, it's been pretty incredible. I think there's only about 40 or 50 people in the course worldwide. And yeah, I've met some amazing people. There's psychiatrists, neuroscientists, cardiologists, orthopedic surgeons, anaesthetists, dentists, and so yeah, no, it's a good mix of people and some really cool people to meet and get to know. So yeah, it's going well.
Great. And you're probably going to cringe at this question. I bet you get asked it all the time. What's the difference between a holistic dentist and a regular dentist?
Well, I think the difference is that we're all about looking at the ways that the mouth impacts the rest of the body, and so not looking at the mouth in isolation. But to be fair to the profession, it's moving in that direction a lot more compared to a few decades ago, and so everyone's thinking more holistically, which is great. But specific to our practice, we look at the role of nutrition, breathing, sleeping. We treat a lot of sleep apnea, headaches, neck aches, jaw aches. We treat a lot of obviously gum disease, and we educate our patients on why it's important to minimize inflammatory load in the body. And so, yeah, I mean, there's links between gum disease and heart disease, diabetes, rheumatoid arthritis, Alzheimer's, cancer. And the common denominator in all of those conditions, including gum disease, is chronic inflammation. So we try and educate our patients to make the best lifestyle choices to minimize their inflammation in their body and breathe better and eat better and sleep better and build resilience into their life. And I suppose in a way I use my new patient consultations not to just quickly get through a check, a clean and some x-rays. I obviously do all those diagnostics, but I try and use it almost as a health coaching opportunity to make an impact on their health. And so in our profession, we're very fortunate. Being a general dentist, we get to see people kind of every 6 months, and so you see people every 6 months for years and years and years on end, and so you can really see the impact that you're having on them over time, and just trying to inspire them to live a healthy lifestyle. So that's I suppose the crux of a more holistic outlook on health and dentistry.
Thank you. And you mentioned breathing. I think I told you that I was a Buteyko breathing instructor,
Yeah.
and our trainer, Patrick McEwen, he absolutely loves dentists and he thinks they could be making the biggest impact on holistic health in the world if they teach their clients to nasal breathe. But firstly, because like you said, you've got a great business role model. You see people every 6 months. And usually, if you see the parents, you're going to see the children as well. So you
Yeah.
could be checking the children's mouths to see, are their mouths overcrowded? Is their tongue dry? And all the things you mentioned, like headaches and not sleeping well, and those are big indicators that they're mouth breathing.
Yeah.
And did you do special training to teach people how to nasal breathe or?
Yeah, I've done many seminars on breathing. There's obviously a few great practitioners around, like obviously Patrick's one, but he's also trained a lot of people in Sydney, and I've gone to a lot of those courses. And yeah, I've had Dr. Rosalba Courtney on my podcast as well, and she's got a PhD in breathing, and she's an osteo as well. So yeah, I've just been able to go to some of her courses and connect with a lot of people in the breathing space, which has helped because yeah, we see a lot of kids, and a lot of kids actually don't have broad upper and lower jaws as much as they should for optimal health, because obviously the size and shape of the jaw dictate the patency or the openness of the airway, and that can have huge flow-on effects to their behavior, their concentration, their growth curve, their appearance, all these sorts of things. And so even their decay rate, how much tooth decay they have, if you're drying your saliva out because you're mouth breathing all the time, you will leave yourself susceptible to oral diseases like tooth decay and gum disease as well. So yeah, I mean, I see a lot of kids in my practice, and I really like seeing kids because you can make such a big impact on their health, and breathing is a huge component of that.
Yeah, because one of Patrick's gripe as well, because if you're mouth breathing, you're breathing in all the gunk, all the pollution, because obviously when it comes through the nose, it's filtered and sterilized and warmed and all the rest of it. But children who are having their tonsils and adenoids taken out, then in the hospital, no one is there to teach them good nasal breathing. So they
Yeah.
go back to the bad habits. And so what are if you say to the parents, look, your child is mouth breathing, in general, because I know a lot of parents want a quick fix, because Derek Mahoney was saying that as well, the orthodontist who specializes in breathing. It's very hard to educate the parents because everybody's time precious and busy, and they think, oh, well, when they're 11, 12, they can have a brace and that will change their appearance and they'll be fine.
Yeah.
So do you help educate the parents? Because obviously they're not going to encourage the kids to do the breathing exercises.
Yeah. So, I mean, I think with anything, when you're trying to get behavior change, you have to actually give people a why. And I spend a lot of time educating people on why we are suggesting a particular exercise or, habit change or what have you, because if people don't understand why they're doing it, then they've got no motivation whatsoever. So part of the behavior change angle there is to make the parents really aware about why this is important for their child's health, and then you'll find that you'll get a lot more buy-in to some of the exercises and techniques to try and reverse some of these habits, but also understanding the link between nutrition and the environment that the kids are sleeping in as well. Like a lot of houses have mold and dust and damp, and we're eating more and more processed foods every year, and so this can be really inflammatory to the nasal passages and the tonsils and things like that. So it's a multifactorial issue, but yeah, really honing in on why we're doing it and how much of an impact it's going to have on both their children's health, but jaw development, but also just, you talk about their people going off and having braces done and then never getting to the underlying cause as to why the teeth are crowded. You take the braces off and then there's orthodontic or, relapse, and they have to do it again in their 20s or 30s. And we're trying to, motivate the parents to understand that we're trying to also not let them relapse over time as well. So that's a motivating
Yeah.
factor.
Oh, great. So obviously I know the questions you asked me, but what would be typical questions that you ask a client when they come to see you?
Do you wake up refreshed? Do you wake up with a dry mouth? Do you have drool on your cheek or your pillow? Do you need to have a nap during the day? Are you likely to have to doze off, in traffic, at a traffic light, or are you likely to doze off on the couch without having any alcohol? Do you get a lot of nasal sinus issues? Are you always got a blocked nose? For kids, are they bedwetting? Are they waking up with a dry mouth? Do they have a lot of tooth decay? Are they irritable at school? Do they concentrate well? These are all questions that can hint at some sort of airway or breathing problem. Yeah.
Great. And I read recently, came up on my feed about Australia has the oral health tracker.
Yeah.
Yeah. Do you want to explain a bit more about that?
Yeah. So the Dental Association have just done a whole bunch of statistics on where we're at oral health wise, and that means like the burden of disease in society, how common diseases are in Australia, how many times people brush their teeth, how many holes they have in their mouth on average. Um, Globally, actually, oral diseases are the biggest burden of disease out of any disease. Like we always think, oh, heart disease or cancer, it's always front of mind. But the World Health Organization actually released a statistic quite recently that showed about half the world's population have oral disease. So this is like 3.5 or close to 4 billion people have oral disease. And so I think compared to cancer and heart disease, this is around 800 million or 500 million respectively. And so people kind of turn a blind eye to how prominent it is and how much it impacts your general health. So yeah, I think in Australia we're not going amazing. The oral health tracker doesn't suggest that we're doing so well. I mean, half of Australian adults only brush their teeth once a day, for example. Kids, tooth decay is pretty rampant. And so I think this is it's basically a motivating factor on where we're at and where we need to go. But big room for improvement. Yeah, massive.
Yeah. Oh, wow, that's amazing to hear that, considering people I know as a child, we were back and forth the dentist, every 6 months, as you said. My mother was very strict because with me, for example, my lower jaw was too small, my teeth were overcrowded, they were overlapping, and I had double rows at times, but back and forth the dentist just loved me. And in those days, they just whip your, extra teeth out and so forth. And I had impacted wisdom teeth. So I was forever going in and out. But I'm just thinking, if the oral health is so bad, do you think that maybe it's because we're not brushing our teeth correctly? Because I religiously went to the dentist and I would follow what they're saying. But I just thought now maybe, because one time in France, I seen a periodontist, and because he didn't have my records, he just said, oh, you must be eating, crispy bread, or you're over brushing. And how important is it to learn the correct techniques, and do you go through that with your clients? And is it one technique for everyone? And are different toothbrushes for different people, depending on the
Yes.
state of your gums, I'm guessing?
Yeah. So oral hygiene is so important. It's one of the best ways to keep your mouth healthy. Obviously, if you're not cleaning all the surfaces in a systematic way and you're missing certain spots month in, month out, then obviously that's where gum disease and tooth decay can occur. Um, so twice a day, 2 minutes with really good technique is important. And so we have a whole bunch of dental hygienists at our practice, and they spend a good hour with every patient that comes through to clean their teeth really well. They measure the pockets, so the distance between the gum and the underlying bone. That's measured, and in good health, that should be about 1 to 3 millimeters. About 4 to 5 millimeters shows there's a little bit of gum disease around, and then 5+ is a problem and leaves you more susceptible to those things that I talked about, like Alzheimer's, cancer, rheumatoid arthritis, diabetes, etc. And so we measure everything so that it's not willy-nilly cleaning. We always measure people's levels to see where they're at, and then they spend so much time going over brushing and flossing techniques so that you can keep the mouth really healthy. But what I would say is that it's a multifactorial condition. So you can brush really well and you can floss really well, but if you're not breathing through your nose, you're not eating nutrient-dense foods high in vitamins A, D, E, and K, and omega-3s and calcium and things like that, then you're obviously going to be up against it. So hydration as well is really important. Dealing with gut issues like reflux and irritable bowel syndrome, things like that, that can also impact the state of the mouth. And so, yes, oral hygiene is so important, but so are all those other factors that I mentioned. And this is kind of the more holistic approach.
Right. Yeah, because you mentioned about tooth decay in babies as well and young children. And I remember years ago in France and the UK, at least 20 years ago, they were stopping or advising the mothers not to give the children orange juice, because it was so high in sugar content, and not to even drink it, because obviously when you're pregnant, all the nutrients are going to the fetus as well. And yeah, what are your thoughts on the juices?
Yeah, I mean they're really sugary, and so that can cause tooth decay. And I used to work in the public sector and have seen a few really nasty incidences of like really young kids being given like Coca-Cola, like to sip on when they're infants, just to ease them to bed. And I've had to take out every single one of their teeth when they're little babies and things. So, well, not little babies, but young. And yeah, it's really sad to see. So, juices, soft drinks, energy drinks, most alcoholic beverages, even sparkling mineral water, carbonated beverages, kombucha, these sorts of things can be, even the ones considered healthy,
Yeah.
can be quite nasty for your teeth, because your enamel will start to erode away at a pH of 5.5. And so water's neutral at 7. And wine's 4 on the pH scale, kombucha's 3 on the pH scale, juices are like 3 to 4 on the pH scale. Even carbonated water is quite low at around 4 as well. So there's things that are best avoided. Water's obviously best, and still water, I mean. And yeah, all these juices and all these other processed sort of drinks are problematic.
Right. That's really good information. I hope our listeners will take note of this. And obviously, you do a lot of exercise still. What benefits are exercise for the general health as well, or is that part of your package? Do you still work as a personal trainer and a health coach separately? I'm guessing you don't have any time, because even to try and get an appointment with you, you're back to back.
Yeah, so like I said, in those new patient exams, I kind of use my health coaching um, qualifications to try and work out what's going on with their nutrition and their sleep and their breathing, and you know, try and instill some good habits in those new patient exams. But specifically separate to the business, I don't really have time to do any strength and conditioning training like I used to do for other people. But I still really enjoy doing it for myself. I recently have been training hard for my sprinting, and yeah, went to the state titles last year in the 100 meters, and I love it personally, and I feel a lot better when I'm training, and I try and really get my patients motivated to move their bodies, because it's sometimes said that the best posture is the next posture. We got to keep moving, and that helps our system. And we're designed to move. We're not designed to be the way we operate in the modern world. We're not designed to sit behind computers in blue light with air conditioning. We're meant to have our feet on the ground. We're meant to see early morning sunrise, late day sunset, and then you know just keep moving our bodies. So everyone should really find something that they enjoy and stick at it.
Yeah, that's great tips, and especially to say find what you enjoy, because it's different strokes for different folks. But going back to the sugary drinks, since we've been traveling nearly 2 years now in a camper van, we can't believe how overweight people are. I know you're not allowed to tell people they're fat anymore, but there's so many overweight people, and the children especially, and not only in Australia. We went back to France in May and also to the UK, and everybody's so huge, and now travelers are coming to Australia. It's I think obesity is a massive problem. What are your views on that? Because obviously, I was with some people a couple of days ago, and they were saying to me what to do to keep fit. And I'm like, well, at the moment I try to swim about 3 times a week in a lap pool wherever we go. And it's a good excuse to have a lovely hot shower, do a hot and cold shower, because our shower's not regulated in the van at the moment, set up. And then go hiking, and like you say, there's no excuse. You don't have to join a gym. You talked about the sunrise, sunset. People can be out in nature, and even if you live in the built up urban district, you can walk around your block. But what are your thoughts?
Yeah, I think that we're eating a lot of high calorie, low nutrient food. That's the problem in society. We've
Mm.
got like the infiltration of corporate interests through our food supply, and it shows in the obesity rates in children and adults, and it keeps getting worse and worse. So, but also, being overweight can also be a result of the stresses of the modern world. Like, most people are overeating, they're overstressed, they're, like I said, they're trapped inside all day. They're sedentary. A lot of people don't sleep well. A lot of people have sleep apnea. As a result of being overweight, you can increase your risk of sleep apnea. So, the size of the neck and your sleep position and things like that can affect your ability to breathe well while you're asleep, and so that will actually make you put on weight as well. So there's nutrient poor foods, there's lack of movement, lack of time in nature, highly stressed people out there. Like, I see it all the time, and you'll just put on weight if you're stressed. And it's easier said than done to reduce stress, but you got to try and go back to eating nutrient dense whole foods. You've got to try and get good sunshine. You got to try and meditate or relax, do yoga, try and calm your system down as much as possible. Sleep really well, prioritize your sleep, get off electronics at night time. Understand the impact of the modern world, like lights on our circadian rhythms, and this can help to reduce a lot of the obesity situation that we find ourselves in.
Yeah, I totally agree. And because you're a businessman as well, what tips would you give to people starting out in business to become a dentist, for example, but with all your qualifications, you could start up a new business as well?
Um, I think just to be really, I mean, from a dental standpoint, I think it's really important to have good communication skills, really connect with people, be empathetic, and be reliable. People love to come back to the same person that they like seeing all the time, and so being empathetic and being, really motivated to help them and make them get the sense that you really care for them. I think that's a huge thing in any business, but particularly in healthcare, because people really want to know that you're on their team. So that's one thing. And then I would say to people starting out in the dental world or any health world is just to stay really curious and keep upskilling, and that makes you motivated, and it allows you to provide the best, newest and modern techniques, which is what people are really after, rather than the old. And obviously some of the old stuff works and is tried and tested, but just to be curious and keep upskilling is so important, and that's what I've found to be really motivating in my career so far.
Yeah. And what about people who are not motivated, or people who, because we've gone through a lot of change, people have lost their jobs and the way of life as we knew it? What tips would you give to them if they've got to start a brand new career?
I just think really sitting down and thinking about what your values are and what you really find interesting, because we spend so much of our lives at work, probably 75% of our lives are at work. And so imagine picking something that you don't enjoy. So I think showing an interest in it, being really motivated to get up and enjoy your work. I know it's easier said than done. Some people are trying to make ends meet, and cost of living crisis is here and with us probably for a while. But I think that where possible, going for what motivates you is going to hold you in good stead, and just so important for your general health. If you're spending so much time at work, you've got to try and enjoy it as much as you can.
Yeah, that's great tips. And I know we've met a lot of people who've been high corporates while we're traveling, and they've just given it up to travel. And they've been doing things like mowing the lawns in hospitals and bar work and all sorts of things. And they said it's just like being in nature and living and meeting real people and reevaluating your values and morals.
Yeah.
And, because a lot of people, you can be slaves to your job. Yes, you might have good income. However, your family life suffers. You might be doing 50, 60, 70 hours a week. You might be away from home and so forth. So
Yeah.
that's good. I read that you are a bone marrow donor, and this is your proudest achievement. What inspired you to become the donor?
So my brother, when he was in his early 20s, is my older brother. He was unfortunately diagnosed with leukemia, and
Right.
yeah, so he needed a bone marrow donor, and obviously the first port of call is to check if your family is a match. And luckily, I think there was about a 25 or a 50% chance that we would be a match. And thankfully, I was a match with him, and so we didn't have to go looking on the registry to find a random donor from around the world. And it was good in the sense that it was the perfect amount of difference without being too different. Like if you got bone marrow from a random person, sometimes it's very irritating to the body, and you can get a really bad reaction. But my level of difference was just the right amount, and so yeah, gave him my bone marrow, and when he needed it, and yeah, he's made a full recovery and is married and has two kids, and yeah, very very happy to see him get a new shot at life. And yeah, it was a nice moment between two brothers. So I always try and encourage people to get on the registry. You can actually get on the bone marrow registry in your country. Um, and the chances of you being called up are very minimal, but in the off chance that you do, at least you can help someone in need and give them another chance at life.
Oh, wow. What a wonderful story with a great outcome. Because when you started talking, I felt quite teary. My heart was going out to you because I thought, oh, please, please let this be a happy ending. So that's wonderful news.
Yeah,
And yeah, so if there was one thing you could do to change the world, what would that be?
it's a good question. I think I would make people, well, not make people. I would I would advise people just to show a bit more love, empathy, connection, and just share that human spirit rather than getting caught up in the modern world where we're obsessed with the superficial, the external, the the material, and just go back to connection and being human with one another and really caring for each other, because I think at the end of the day we are all connected. And I like to think about my patients, that they're me and I'm them, and we're connected and we're just trying to get through this journey together. So I think that that's what I would try and do for the world if I had the power to, but hopefully it happens.
Wow, that's amazing. And I really think we're moving into this era. Like people are talking about a paradigm shift because everything happens in cycles. And they're saying now is the time for more love and compassion coming into the world. So if people like you and I are putting out those positive thoughts and, you know, as we're all what we think is what we are, and we radiate those thoughts out. So it's nice. I like to visualize showering people with love and yeah, because we never know what's going on if someone is shouting their mouth off and um, you don't know what happened before they came to work or came wherever, what's happening in their day. So talking about shouting your mouth off, tell us about your podcast and how you got into it.
So about 5 years ago, I started the podcast. It's called Mouthing Off, and I just wanted to get some really good health information out there by interviewing experts in their various fields. So I've had cardiologists, I've had diabetes experts, I've had longevity experts on, obviously breathing experts, psychologists, neuroscientists, just a whole range of interesting people from around the world, and just trying to get some really good, unbiased health information out there, because it can just be a real minefield of confusing and conflicting information. And so I just thought I'd promote health in the community as best I could, and from my own perspective, I've learned so much from it and all the guests that have come on. So, and that helps me day to day to talk about things with my patients that can improve their health as well. So yeah, I've really enjoyed it.
Wonderful. And what's next for you? I know you're doing your research.
Yeah, so just going to finish off this masters, and just continue to provide our patients with really good quality care and keep improving that aspect of things. But I think just for me, we can get really caught up in always wanting to do the next thing and achieve the next thing. But I'm just getting to the point now where I want to spend more time being present and with people and the people that I care about, and that's on the horizon for me.
That's wonderful. And you mentioned your brother. Is he a dentist as well, or have you got other siblings? Are they? in the dentist field as well?
No, my brother's not in dentistry, and it's probably for the best. Yeah.
And is your mum a dentist or?
No, she's not. My mum actually passed away when I was young, but she
Oh,
she was she
bless.
was she was a lawyer. She was an environmental lawyer. But yeah, no longer with us, unfortunately.
Well, I believe when we die, it's only our physical body and our life force or essence goes back to the universe. It's always
Yeah,
has been, always will be. So I'm sure
yeah,
she's around you and very proud, and you can talk to her every day.
yeah. I
So
agree.
thank you. And thank you so much for giving up your precious time.
No worries. It's been a pleasure. Thank you.
Thank you.